So aesthetics with stem cells, this is, and we're one of the few places in the state that are doing it and have been doing it since we really could. We're able to do the same thing that we're trying to accomplish with joint regeneration, except really focus it in the dermis. So whether that's hair regeneration and turning those dormant hair follicles back on again, along with the vascular production needed to keep the nutrients to keep those hair follicles turned on again, all the way down to causing damage in the dermis in your face and seeing all that new elastin and collagen turn back on again naturally without any downtime associated with it, and it just gets better and better and better. We've never been able to do what we can do now. Now, regenerative medicine, I'm specifically talking about stem cells, but there's PRP, which is growth factors, and growth factors is a big buzzword out there as well. So vampire facial is microneedling, which we do here, and PRP, and we have 3 different PRP devices. It's giving your body growth factors. So when you're thinking about regenerating tissue, think about, so you're in the kitchen, you're making tacos or whatever, you slip and you cut your finger with a knife, and your body sends out a distress signal to the area. Your body's stem cells are going to go to that area. Think about them like worker bees again. They're going to utilize the growth factors. Think about that like the scaffolding and the tools necessary to rebuild the tissue. So the two work together. So when we microneedle on the face, we're causing damage to the area, basically by poking a bunch of holes, but we have these micro channels that then are ready to receive whatever the body needs to heal. So cause some sort of damage, in this case microneedling, and give the body growth factors to regenerate. So when somebody's young, it does a really good job of utilizing growth factors because you still have quite a few in it. If somebody's over 45, we might have to jump up and utilize a higher grade of growth factors, which is amnion. Amnion. So in the womb, the baby's fed through the umbilical cord coming from the placenta in the amniotic sac and the amniotic fluid, right? All of that is chock full of stem cells and growth factors, the highest that we ever have in life, which is in utero. The downside is the second that birth occurs, whether it's C-section or vaginal is irrelevant, that tissue is no longer considered a sterile environment. So what they have to do is they have to do a hard cold snap freeze for any amniotic tissue where they drop it down to negative 386 degrees immediately. What that does is it kills any pathogens that might be present, but unfortunately it's also killing all the stem cells. However, we're left with the highest concentration of growth factors that we ever have as a human, which is in utero. So then we can utilize those growth factors and combine it with PRP, and it's like PRP on steroids in terms of how many growth factors that you have. We can inject it, we can put it on topically, we can do PRP in joints, we do all different kinds of things, but PRP with amnion is kind of the middle point in between stem cells and growth factors. Then we jump up to stem cells. And this is where things get really, really exciting because no matter how awesome the growth factors are, those cells are gone in 7 to 10 days max. That's being very generous. That's why you have to do multiple treatments. When you jump up to stem cells, these cells, we're utilizing live umbilical cord stem cells. We use both Wharton's jelly stem cells and umbilical cord blood stem cells, depending on what application it is. For the aesthetics, we utilize Wharton's jelly, and they're 100% mesenchymal stem cells. You're not getting any other cellular debris or any blood in there or whatever it is, and it has a little bit of DMSO. This is the first product that's ever been designed to be used in aesthetics. For DMSO is a carrying agent. So the stem cells are mixed with DMSO in the vial, and it just allows it to carry wherever it needs to go as well. But this is the purest stem cells on the market right now, and they're live. What's beautiful is we're utilizing 1.2 million live mesenchymal stem cells. They stay alive in your tissue, regenerating tissue, for 90 to 120 days. Beautiful thing about stem cells is not only are they regenerating the whole time that they're alive, during the dying process, apoptosis, how a stem cell functions is as it's dying, it's constantly releasing growth factors. So it's giving the stem cells not only what they need to regenerate, but you're getting pumped up full of the growth factors as well. We've never been able to see this until now. So for hair regeneration, for facial rejuvenation, for skin tightening, we can go right next to the eyes, both top and bottom. It's amazing what we're seeing, and it's just going to get better and better and better. You do one treatment with stem cells and you see full results in 9 months.